In the bustling city of Bengaluru, a groundbreaking innovation in healthcare is unfolding. The Narayana Health Clinical Research team, in collaboration with Medha AI, has just announced a revolutionary tool destined to transform cardiac care. This tool is not just any innovation. It's an AI capable of diagnosing heart function in a mere 10 seconds. In a press conference held on August 5, 2025, the team revealed their breakthrough AI's capabilities. It is hailed as India's first AI tool to swiftly detect heart failure. The announcement sent ripples across the medical community, underscoring Narayana Health's dedication to leveraging technology to improve health outcomes. The story begins with a dream to simplify cardiac diagnostics. Envisioned a future where detecting heart conditions could be as easy and fast as snapping fingers. With countless hours spent in the lab alongside engineers, researchers, and AI specialists, this dream steadily materialized. Medha AI, Narayana Health's advanced analytics and AI division, played a pivotal role. Using vast datasets, the AI was trained to capture subtle patterns in ECG graphs that go unnoticed by human eyes. Its algorithm, honed through relentless testing, boasts remarkable accuracy, promising to save countless lives by ensuring early intervention. Patients benefit not only from the accuracy, but also the speed of diagnosis. In emergencies, every second counts, explains Dr. Patel. Hospitals can now provide timely treatment, thereby increasing survival rates and reducing the strain on healthcare resources. But the innovation doesn't stop at diagnosis.
Yesterday, it's a very long-term investment we have made. I'll give you a glimpse of how it will be. A patient books an appointment in the next 6 months, how it will be. Patient books an appointment to see Dr. Devi Shetty. The moment he books the appointment, he will get a WhatsApp message with a bot. And the bot will take the entire history of the patient in any language, because bot can spend any length of time. Then based on the test, as soon as the history is taken, the bot will request the patient to upload all the images of all the old reports. Then bot will go through it, and it will suggest to the patient that before seeing Dr. Shetty, you come to the hospital, get all these tests done, like a blood test, ECG, echo, and whatever. So once that is done, patient comes to the hospital, he doesn't see the receptionist, every registration, payment, everything happens. They just get the appointment for the echocardiogram at particular time, or a blood test or whatever time, get the test done, and when they come to see me in my laptop, I'll be able to see the entire history and all the diagnostic tests what I've been done, the reports and the old reports. And also I will get to see 3 or 4 possible diagnoses, differential diagnosis from which I can choose from. And when the patient sits in front of me, I'm not going to ask the patient what is your problem is. I'm going to explain to the patient what his problem is, just to confirm that what the bot gave me the history is accurate. That will dramatically change the patient perception about me and the service. First thing the patient will say is that this doctor knows everything about me, because bot would have taken the entire history starting from the childhood to his allergy to family history and everything. That will change the patient experience. And the other important thing, normally we see the patient and we write a list of tests. Patient goes out, get the test done. After 4 hours, they'll come back with the report. That means our doctors are seeing the patient twice. So once with these technologies that are used, I need to see the patient only once and advise. So technically speaking, I can see double the number of patients in the OPD at the same time. This is just the impact in the OPD itself. Like this, when the patient gets admitted to the hospital, the experience will be dramatically different. All these innovations All along, we have waited for the Western countries to develop these technologies. Today, we are developing this because this country is blessed with phenomenally skilled, passionate software engineers, AI experts. This is our strength. And we have, by the grace of God, we made massive investment in building the digital platform, which is far, far ahead of all the other hospitals and the existing EMRs. So with the great combination of a digital platform with the AI tool, healthcare will never be the same. Thank you so much. Good luck and God bless Vivek.
Vivek Rajagopal, the Chief of AI at Narayana Health, and our colleagues are also here. Dr. Pradeep, who heads Clinical Research, Chief Scientific Officer of Narayana Health, Dr. Deepak, who heads our electrophysiology program, and Dr. Abhyuday, who works with our analytics and AI division, part of my division, who builds the AI models. It's a big day for all of us to have built India's first ECG EF prediction model, which basically predicts the risk of heart failure from ECG images. We're the first in India to do it, and it is done based on data from Indian patients coming into our hospital. We are one of the very few institutions from the world that has actually done this. A big day for all of us.
I'm Dr. Abhyuday, and I work as a data scientist as part of Vivek's team, as he rightly said. We basically had this idea thanks to Dr. Deepak Padmanabhan, and because of the able guidance of Dr. Pradeep Narayan as well, who's our Chief Scientific Officer. Combining basically under their guidance, we were able to do this. So essentially what this model is whenever people think about doing any sort of medical investigation, they want it to be very easy to do, non-invasive. It should tell a lot about for the patient, and it should be easily accessible to everyone. So because not all investigations can tell a lot about all parts of the body, we were able to take a simple investigation like ECG and augment and make sure that its basically power is increased in terms of diagnostic capabilities, right? So what this ECG does is usually this investigation is used to diagnose any sort of electrical abnormality in the heart. And it does not tell if there's any sort of physical or structural, as we call structural damage to the heart. For that, you'll have to do an echocardiogram. So what we have been able to do using AI is essentially take a huge data set which was digitized thanks to Narayana from all of our Indian patients, and then see if we can use this investigation, which is used to predict electrical abnormalities, to predict something wrong with the physical aspect of it. So because we are able to do that, now we have a tool to screen for a lot of diseases that we would not have been able to do so because of the size of our population. So this is the great innovation. So we'll be able to diagnose any sort of cardiac abnormality, which is if there's a problem, very easily using ECGs.
So we are still in a testing phase. We have not really introduced it to the clinical practice just yet. We are waiting for further validation, and we also need to take some regulatory approvals before we can introduce it to the patients. But we have received validation from our peers. So we developed this model almost 18 months ago, but we never released it to the media. We never told anybody, because we wanted our peers, who are our biggest critics, to evaluate that. And as we have mentioned before, this won the Digital Innovation Award in whole of South Asia, and this award was given by the British Medical Journal. This has also been published in the Indian Heart Journal, which is the largest journal in this country in the field of cardiac care. So we have achieved all that, but we have still not introduced it to the patients. We want to test it further. We want to get the regulatory approvals, and following that, we'll do that. Thank you.
So one last question. Just wanted to understand what is the future of it? Where do you see, because this is just a start, we have done something phenomenal. What is the future impact, both nationally and globally? Because as you mentioned earlier, we are one of the first one to do this in South Asia. So what do you see the future impact of it, or the use cases, and to make it in a scale, basically?
See, the impact is going to be phenomenal. There are several use cases. As I explained earlier, you could, right now, people in the peripheral areas don't even have an access to a doctor. But everybody has a smartphone or knows somebody who has a smartphone. Everywhere in the country you can have an ECG done. So quite easily you could take a picture of the ECG, send it to us, and we can tell you in 90 seconds if there is anything wrong with the heart. Apart from that, if you imagine being seen, you're going to your, say, a gastroenterologist, and you have got pain in your abdomen. Now sometimes pain from the chest can also be radiated to the abdomen, and they order a ECG. And the ECG finds that even though you don't have any symptoms, this model tells that there may be a problem, and you do get investigated further. So the impact is enormous. And also, if you think about the health screening options, we often go for health checkups. Now, thousands of people go through health checkups, they just get an ECG done, which is read by a very competent doctor. But what we have shown is once you have this AI-enhanced ECG model, the opportunities are immense. It can predict things which humans can't. And I think that is another phenomenal use of this model. I mean, I can go on, and it's just never ending. But I think it's just enormous. It's going to change the healthcare landscape of this country and of the world.